During my internal medicine sub-I as a fourth year, I had the opportunity to look after an 80-year-old gentleman who lived here in Philadelphia without any family support, without any friends, and he had been struggling for years with management of his diabetes. And it was proving to be way too much for him to manage on his own, and therefore his blood sugars were all over the place, and he was finding himself admitted to Temple multiple times a month. Fortunately, over the course of his 2-week hospitalization, we were able to meet with my general medicine team, the endocrinology team, social work, and case management to finally come up with a plan that would get him out of the hospital and hopefully not back. So it was the opportunity to really bond with my patient and get to know what was going on at home that the rest of the team hadn't had the chance to see and to learn about him. That made me realize the opportunity we have as medical students here at Temple to play a critical role in our patients' well-being.
I'll never forget a patient that was on my medicine service who came into the hospital because some abnormal lab values, and we found out that he had esophageal cancer. Upon delivering this news, the first thing the patient asked was, "What's an esophagus?" And after that, we sat down with the patient, we talked with him, we drew some diagrams, and we gave him some comfort. And in that moment, we were all together, and that's a lesson I'll definitely take with me.
The patient I had originally presented to the emergency department because he was actively suicidal. As I was kind of going through the standard interview, I found myself more and more just listening to him instead of asking questions, and he really opened up to me about his frustrations and how he felt disconnected. We talked for a little while more down in the emergency department until he was eventually admitted upstairs. I ended up seeing him a couple weeks later up on the inpatient floors. It was actually his day of discharge. And noting him from afar, he actually looked really great. And he was so thankful for the people who had helped him towards his recovery. And he thanked me for really just that first day, just listening to what he had to say.
So I was taking care of actually 2 brothers who had been the victims of an unfortunate situation. I got to know the younger brother pretty well, and we kind of had this inside joke where he, for some reason, thought that I looked like his cousin. And every day, after we established that I was, in fact, not his cousin, he still called me cuz. So we had this little tradition where every day when I'd go in and see him in the morning, he'd greet me and say, "How's it going, cuz?"
I was on the labor and delivery service, and one particular female prisoner was scheduled to have a C-section. So she was waiting, and I noticed that she was crying and she was very sad. So I walked up to her. She was like, "Can you call my mom? Can just someone call my mom?" So I told her, like, "Okay, I don't know what we can do. I'm gonna find out." So I went to my upper years, and kind of doesn't work that way, and I understood because of the law and everything like that. So I went back to her and I said, "I'm sorry I can't call your mom, but I can hold your hand and I can just be with you for a while, if that's okay." For one moment, she had someone there for her, and I was very grateful to be that person, to be there for her.
He was originally from Mexico, and he had moved to the United States in the year 2000. At that time, he was actually diagnosed with colon cancer. By the time that we saw him in a clinic, he had actually spent multiple months, almost close to a year, complaining of this back pain. This case pretty much stayed with me throughout the last couple of months since I finished my family medicine rotation, just because of seeing how a patient not being able to afford medical care because of the fact that they don't have the proper legal status to be eligible for insurance, seeing how that can pretty much incapacitate their ability to be healthy.
I had met her early in 3rd year. I was on a surgical oncology rotation. That was one of my first clinical rotations. Each morning, pretty early, the entire team would rush into her room, the attending, the fellow, the resident, and the medical student to do some dressing changes and assess her wounds. And at first, I was a little nervous. I was still green. It was one of my first rotations. So I'd kind of stay in the back, maybe hand the fellow some gauze or some tape. But over time, as I grew more comfortable, I started to realize that I could probably be more help if I just focused my attention on the patient. So we would talk about things to keep her mind off of what was going on. And I think that helped. I think it helped me as well, not just her.
I walked into the room, there was an elderly couple there, and I started to take the patient's history, and they were just giving me these looks like, why is this medical student here? And the reason that the husband, the man, had come into the doctor's office was because he was applying for disability. In that time that I spent with the couple, by being patient and listening to them, I was able to write multiple drafts of a letter that they needed for the application process. And once we finally had our final draft, I gave it to them, and they were so appreciative, and they thought that I was going to be a great doctor, and I was laughing inside because I didn't have to make a single medical decision.
So it was early on in my surgery rotation, and I was still a little bit nervous, didn't really know what was going on, but they asked me to scrub in on a case, and then I was never one to say no, so I scrubbed in. And about 2 hours into it, I started to get a really bad itch in my back, and I wasn't comfortable enough in the OR to ask anybody to itch for me, so I just was going to wait it out. So when the attending asked to go back to back with me, I was a little bit confused. I didn't really understand that the reason you go back to back with somebody in the operating room is to keep the sterile field sterile. So, and I had the really bad itch in my back. So when we went back to back, I swayed a little bit. The attending was very confused. Said, "Lee, what are you doing? We dancing?"
One particular patient that I remember clearly who was brought back from the edge to leaving the ICU by the end of my block. And it was incredible to see her sit back, surrounded by her family, wearing her clothes as she went home. I think it was in those moments that you remember that what happens in the hospital is a short part of somebody's life. It can be a very powerful and important part, but it's just one element of their life, and it was especially important for me, I think, to see that, and we don't always get that experience, and I'm super thankful.
One person stands out in particular. He was this 40-year-old gentleman who had just recently came to America from Puerto Rico, and he was diagnosed with HIV, and he had terrible anxiety. So one of the times that he came back in, he was like, "Charlie, I've got this muscle twitch in my leg. I don't know what's going on. I think I'm dying." So, I said to him, "Let's just calm down. Lots of people get muscle twitches. You probably just need some more potassium, eat a banana, you're gonna be fine." So the next time that he came back, he was like, "Oh, you were right, I'm eating a banana a day and it's working for me great." So on one of my last days at the clinic, he came back and he knew it was gonna be the last time I was gonna be there. So to say thank you, he brought in this grocery bag and pulled out this bushel of bananas to give to me.
When I think of a humanistic experience, I think of Honduras. I and about 25 other of my classmates, fresh out of our first year, visited a very remote area of the country for a week-long medical brigade. And upon arrival, we were immediately immersed in this community that relied on one another. And it was very refreshing to see the sense of community that everybody had. It immediately became clear that I wasn't just here to practice my doctoring skills or to fumble through medical Spanish. I was here to incorporate myself into a community, to learn, to appreciate, and to get a sense of what they value. To keep it very simple, Mr. Katz once said, "What you can do is make every effort in your life to make a difference."